Smallpox was one of the most frightening diseases the world has known. It killed at least 300 million people in the last century before it was eradicated. So it came as quite a surprise when the U.S. government revealed yesterday that vials of smallpox had been forgotten for decades and were just discovered in a cardboard box. The big question now is whether the virus is alive, and Dr. Jon LaPook learned more today from the scientist heading the investigation.
The vials of smallpox are currently being tested in a level 4 high-containment laboratory at the CDC in Atlanta. That is the agency's most secure facility. You can only gain entry through a special eye scan. Steve Monroe runs the Division of High-Consequence Pathogens.
Is it possible the smallpox can still grow?
It's possible, but we don't know for sure if the smallpox virus in these samples will still be able to grow in the laboratory.
What's your guess?
I will not be surprised if one or more of these samples contains live growing smallpox virus.
But then you're going to destroy it and it'll be gone forever?
We will destroy it and it will be gone forever.
It was July 1st when a lab worker at the National Institutes of Health found the smallpox vials while cleaning out a storage refrigerator. The vials appeared to date back to the 1950s. From that moment, the CDC, NIH, FBI, FDA, and World Health Organization worked closely to develop a plan of action. The White House was immediately informed that a potential agent of bioterrorism had been found.
What was the security involved in moving the samples from Bethesda, Maryland to the CDC?
The security involved the cooperation of the FBI as well as local law enforcement, and so there was ground transport to the appropriate air assets that were provided by FBI.
Monroe says the trickiest part was making sure nothing happened to the fragile glass vials that had likely been stored for 50 to 60 years.
How could this have happened?
I think this is one of those flukes. It's sort of the trunk that's in the attic that nobody's looked at for many, many years.
Are you asking lab directors to go through their inventories, look under the tables, look in the closets?
Certainly one of the lessons learned from this episode is that laboratories around the world should have a firm idea of what they have in their collections, and that people should make an effort to do a complete inventory.
The material in the vials was freeze-dried and the end of each glass tube sealed shut with a flame. In all 6 vials of smallpox, the seal was intact.
John, why does Steve Monroe think some of the virus may still be alive?
Well, there are instances of the past where vaccine against smallpox, and that contains live virus, was freeze-dried, it was sealed shut just in a similar fashion, and then it was stored for 20 years or longer. It was reconstituted and it was still infectious. So the question is, how long was the current sample stored at 5 degrees centigrade, and was it ever at room temperature, and will it at the end of the day be able to be infectious? We still have to see.
And then they're going to destroy it.
Absolutely.
John, thanks very much.